Majority of people out there that does not have access to healthcare, we provide them an opportunity to access us. Not only people with insurance, but people without.
When the focus boils down to those that don't have the ability to pay for literally anything, and then you really have to take a step back and say, how can I accomplish this goal of getting them well without putting them into bankruptcy?
My name is Daniel Arsat, and I recently graduated from nursing school this December of 2015. I started working here at Centro Medical Cathedral City as of April 18th, new grad. I think it's a great field. Whether you're a young nurse, whether you're an elderly nurse, it's a great field for you to come into, and it's a growing field. I'm not sure if you're aware, but outpatient services is the future. That's what it is. Acute care services are always going to exist, and there will always be, the need for nurses to fill those roles, but ultimately we need to focus in the outpatient services. We need to focus on being the advocates for our patients to prevent the development of comorbidities, of chronic diseases such as diabetes, COPD, all those things, they're preventable. We can do that, we can help our patients, and I strongly believe in it.
First of all, is we have to realize that we have preconceived biases, all of us, and it doesn't matter where we're at on the literacy spectrum, from having doctorate degrees all the way down to someone that never went to even grade school. And so we see that spectrum here in the clinic. The biggest thing I can tell people coming in is to try and leave those biases behind and think outside the box. Think outside. Why is this patient, why is this family not able to comprehend what is going on, or how can we go through there? And just step back and say, let's go back to basics.
Community outreach programs that actually go out into the various communities. Health fairs are really big for us. So with our community outreach people, they find these events that are being offered. We go to those events, advertise, market ourselves as an opportunity before you do get healthcare, and come to us for your healthcare needs.
They have at least 5 or 6 mobile units, all in various ages. So the one that I was working in was one recently purchased, and it's an RV. It's a large RV. Some of them are the size of full-size buses, and we have some that are fairly old, and we have some that are brand new, state-of-the-art, have Wi-Fi, satellite, their own dental suites. They're pretty awesome, and so it provides them that care access, so they don't feel intimidated by going to a hospital or an emergency room, and that also relieves that sort of pressure on the local services like 911, like emergency rooms, for stuff that doesn't need to go. What you see on TV is not real life, and so I try and tell people that want to go into healthcare is know the areas around you. Keep your eyes open to get an idea that if you want to serve the vulnerable populations, you have to see the living conditions that they're in. Exposure gives that perspective, and I think that's why it's so important to spend time in ambulatory care centers and FQHCs, because FQHCs are set up to take care of these populations.
There's a debate going on in society whether healthcare is a right or a privilege, and we believe that it's a right, and so we want people to have access to care and good care.
Borrego's pro-community. They're here for the people. We go throughout the community, there's different school districts. We go to events and any other place that they're needed. Man, he was diagnosed with a terminal illness. He had no insurance. The family was back east, and he had no one here. So at night, he would be in the room alone by himself. You know, he really didn't have anybody. No one wanted to talk to him. And all he said was, "I need someone to talk to me." We had a strong bond, and at the end of the day, he even told me, he goes, before he passed away, he was very happy and very fortunate that I took time out to spend with him, and I didn't matter. He goes, "I saw it in your eyes that you didn't care who I was or what was going on in my life. All that mattered was to see a smile on my face. Every time you read to me, it didn't matter what it was, a newspaper, magazine, because it felt good having somebody there beside me, and I thank you for that." And those were his words to me before he passed away. And I always remember that. So every time I'm with the patient or something, I always think of him. Because at the end of the day, you can see 100 people, but if you touch one person's life, that's what makes all this really matter.